Hello and welcome. It's quite clear now that the impact of COVID-19 lies way beyond the flu or influenza-like conditions, even for the majority who are not much affected by this dreaded disease. It's also evident that this disease affects many more organs beyond the lung and respiratory tract, including the heart, kidney, brain, and the gastrointestinal tract, among others. What more do we know, and can we in some ways be more aware and alert about these conditions and how they could affect us, particularly since, as it's quite clear, that some of that impact can be long-term and not something that we had anticipated, and surely not a situation where people could get cured and everything would be normal once again. So to discuss this, I'm joined by two specialist doctors, Dr. S. Chatterjee, Senior Consultant, Internal Medicine at the Apollo Hospital in New Delhi, and Dr. Jeenam Shah, Consultant, Chest Physician and Interventional Pulmonologist at Saifee, Wockhardt and Bhatia Hospitals in Mumbai. Thank you both for joining me. Let me start with you, Dr. Chatterjee. So, how have you seen in the last few weeks or months the disease play out, particularly when in the case of patients who we thought have been cured or have been cured and maybe now showing a negative COVID negative, and yet facing other kinds of problems?
See, there are minor problems and there are moderate to major problems that we are facing with patients who have supposedly recovered from COVID and with supposedly when the testing was allowed and all that, and they were tested negative for COVID, maybe around day 14, day 15. Most common thing that we are facing every day, the most small problem is that they continue to have a low-grade fever for a much longer time than what we expected. They would have fever for about 4 weeks, 5 weeks, and without any other cause of fever being found out. And that really troubles the patients and the relatives as to why they are having fever. That also confuses us because we also start looking at other causes of fever and all these things. Weakness is a feature which is variable. I would say that weakness is something which is there in a few patients and is not there in quite a few other patients as well. So weakness is not a constant feature, but is affecting quite a few people. They have GI upsets like loose motions and vomitings even continuing even after the active illness is over. But the major things, what I have seen are two things, is basically one is the heart being affected. I have seen patients developing myocarditis, which could vary from, the degree could vary from a mild to a moderate thing. And it's the right side of the heart which is getting involved. Otherwise the feature. So that is something which is worrying me in the long term, although none of them have really become very serious with the myocarditis, but it is a feature which we are seeing in the follow-up patients. The other thing is the other two things which I have seen already is people presenting with a postural drop of blood pressure and also having giddiness, which is again a postural or a positional sort of a thing that we are seeing. And at the moment, I'm treating a patient who has developed a nervous involvement with nerves getting involved, what we call as a GB syndrome, which is almost developed after 3 to 4 weeks. I don't know whether it's exactly post-COVID, but she suffered from COVID a few weeks back, and she has come with that, and we have not found any other cause for it. So we are seeing multiple organs being involved even after the recovery phase, the supposed recovery phase as 2 weeks is over.
Okay, thank you for that. Dr. Shah, what have you been seeing particularly, and you've been treating a lot of patients and large numbers actively for the more than 3 months now. So have people come back, and with what?
So basically what I have been seeing is a lot of lung fibrosis in my OPD practice. Most of the patients who have been on the ventilator or require very high oxygen in the hospital stay, when they come back in the OPD, most of them are having a lower oxygen than normal. This is because of something condition known as lung fibrosis. So any damage to the lung heals by fibrosis, and it's an irreversible damage that happens to the lungs. So many patients are coming in the OPD practice, they are hypoxic, they are having low oxygen concentration, and they are requiring home oxygen also. So they are somewhat bedridden, if at all, homebound. So that is the most important complication that I've seen. And it happens in quite a few number of patients. It's not that, the virus goes away, you're cured and you're happily ever after. It's not like that. You see a lot of lung fibrosis. So I would quantify, I'm at least currently having 20 to 25 patients who are on oxygen therapy at home. That is something which is, a cause for worry. Apart from that, what I'm seeing is a lot of mental changes. Most of those patients who have been in the hospital for a month, they have been on the ventilator, they have come out, or they have been on the BiPAP support. They are developing a lot of mental complications. They are very worried to go out. They are having a lot of emotional stress on them. They are not able to eat well. They have lost weight. Family is also affected because of that. So that emotional thing is also a very important component post this recovery of COVID infection. And apart from that, as Dr.
Go ahead.
Yeah, and apart from that, as Dr. Chatterjee has also mentioned, that a lot of patients who have developed a MI, myocardial infarction, some kind of myocarditis, they have some residual heart diseases which are prevalent even after COVID infection settles down. These three, I think, are the most important complications that I've seen. Obviously, COVID involves a lot of other organs also. Kidney issues have been there, GI issues have been there, which have been persistent post recovery from the viral illness also.
Right. So you talked about lung fibrosis. Now, tell us. I mean, is that something? I mean, does it affect people uniformly? And you said in some cases it's quite serious. So, and how serious is it? I mean, how does it affect the life or the ability to lead a normal life subsequently, at least at this point?
So, we are still very early into the disease. We still need to, follow up those patients, how severe it is and how long they are persisting with this kind of problems. But whatever initially post 1 month, post 2 months of discharge, what patients have been seeing, the elder the age, the more the fibrosis that I've been seeing. More extensive the disease is, more the fibrosis I'm seeing. These are the two criteria. If the patient has gone on the ventilator, if the patient is very elderly, the fibrosis that is tending to happen is very, very severe. And the extent of severity is that the patient cannot even walk for few steps, cannot even go to the washroom on its own without panting, without able to take support or without requiring oxygen. So this is a very, very severe debilitating disorder that happens post recovery of COVID. But obviously it doesn't affect all the people. It affects only people who are having a severe disease, elderly people, and patients who have been on the ventilator. That is the three subsets of patients who have recovered. Patients who are having very mild symptoms, patients who are having not many problems, have recovered successfully without leaving any residual damage in the lungs.
So if I were to ask you for a percentage, Dr. Shah, suppose for 100 patients that you have treated, how many would you say, I mean, across age groups, how many would you say have recovered completely, and how many are now showing, let's say, some of these residual symptoms, including serious ones?
So whatever data I'll say is going to be biased because I'm only treating moderate to severe patients in the hospital. Most of the mild patients are being home quarantined. So what I'm talking about is moderate to severe patients. Those patients who have come in the hospital, I would say patients in the ICU, almost 10% of my patients in the ICU have gone home on an oxygen therapy. That is a sizable number of patients in the ICU. But if I talk about mild patients who have just recovered in the ward, 99% of them have not required an oxygen therapy, have not developed any complications of lung fibrosis post their discharge.
Right. Dr. Chatterjee, what can I ask you to, similarly, put a percentage in terms of how many would have recovered completely, how many have shown some of these residual symptoms that you two mentioned?
So I would agree with Dr. Shah because fortunately we both work, or unfortunately we both work with a tertiary care center and we handle the same sort of patients. And I would totally agree with him that I actually forgot when I mentioned all my complications that lung fibrosis and hypoxia is what we are seeing very frequently in severe patients who are getting discharged, who were on a ventilator or who required very high flow oxygen for recovery. I would totally agree with him. The percentage, as we said, because we are seeing patients in a big hospital, and that's why the percentage remains the same. But only time will tell us as the days go by, as weeks go by, we will see as to what percentage of patients really recover or they really require a long-term oxygen therapy, because lung fibrosis is something which is not totally reversible and it can remain irreversible for a long, long time.
Right. So, if you look at the kind of patients who've come back, are you seeing that, for instance, people who you thought had recovered completely and also were maybe healthier, showing some signs of, let's say, longer term damage?
See, obviously, people who have comorbidities and the elderly patients are the patients who have suffered the major illness. But even the younger patients, and what I don't find the 50 to 60 age group and even above 45, and men, and especially men, I put them even in the high risk category if they have a bit of comorbidities, because that is the age when we are losing quite a few people, and that's the main age when people are actually very. I really I'm very upset when I lose a patient who is between the age of 50 to 60, because that is the age when you're almost at the top of your career and everything. And we are seeing a lot of patients being lost even in this age group. Yes, I would totally agree that people who have comorbidities, people who are elderly have more complications, but anybody and everybody who has gone onto a ventilator and has required several empirical treatments or several modalities have had more complications than the people who are mildly asymptomatic. But I have seen patients even coming with people who were asymptomatic when they were diagnosed, or people who were mildly symptomatic when they were diagnosed, coming back even 1 or 2 weeks later with several neurologic means numbness, pain, tingling, weakness, lethargy, all these problems, which are, I don't think they are major problems, but which are problems which are troubling people in the long term.
And are you also able to, is it difficult, I mean, are you able to cure this or at least attempt to treat these symptoms, or are they also connected with COVID in the same way?
See, quite a few people actually are recovering with time. But as I said, we are treating it only for the last 3-4 months. So only time would tell us as to how much of these people recover. But yes, 50% of them, other than the lung fibrosis or other than the myocarditis, people with weakness and the GI symptoms or other like giddiness and postural drop and all that are recovering in 2 to 4 weeks time. But quite a few people are not recovering also, and only time would tell us as to what their long-term implication is.
Right. So, Dr. Shah, I'll come to the mental health part in a moment. But if you were to compare, let's say, patients who are or have gone to ICU in the past and come out with those patients with COVID-19 patients who've also gone to ICU and come out, are you seeing this? Is there some similarity, or do COVID patients who've gone into ICU or intubation come out with deeper symptoms and deeper residual symptoms?
So yeah, whatever I've seen in my practice, definitely I would say that COVID patients who have gone in the ICU and gone on the ventilator have come out with deeper symptoms, yes, because the amount of lung fibrosis the COVID infection is leaving behind is much more than rest of the lung infections that we have been seeing in so many years. So yeah, I mean, we don't know the exact pathophysiology, why it is happening so, but definitely I would say that in my practice, the lung residual fibrosis is much more. Apart from that, the damage, which is, because the patients are in the hospital for at least a month, a lot of, muscle wasting, a lot of other GI complications are also leaving behind much more residual symptoms than routinely expected. So I think these two are things that are very significant from my end. Apart from that, the rest of the things I don't think, yeah.
Right. Right. You also talked about mental health. Now, again, is that something that, I mean, all other factors constant, is this higher with patients who have emerged from COVID treatments?
So some amount of mental changes do happens in patients who are in the ICU. Definitely because, in the ICU, and, the second problem in the ICU is that all the people, all the doctors, be it nurses, be it all the, ward boys, everyone is wearing the same uniform. Everyone is just white. You cannot see their expressions. You cannot talk to them. You cannot, generally an ICU is a very friendly atmosphere. We try to talk to patients. We try to cheer them up. But in a COVID situation, everyone, including doctors and the support staff, everyone is very, very tense. So there is absolutely no communication. I mean, no healthy communication with the patients, which is possible. So patients do tend to have, because they have not spoken to their relatives, they have not spoken to anyone nearby. So that mental changes are much more than what you would routinely expect with a normal ICU patients. I have seen even in moderate to mild patients who are, not requiring ICU stay, or just in the ward itself, in the rooms itself, they also tend to develop a lot of mental changes, which is, not routinely expected. Because there is so much fear related to corona that once the patient gets a corona, they think that, it's a doomsday. They're not going to come out. What will happen when they go back home? Will the society accept them? Whether I'll be able to move out of the house again, whether I'll get the corona back or not, whether I'll infect my elderly people, my close ones at the family. So many mental factors which are, going on in that patient mind, and definitely damages their, health, aspect for the patients of corona.
Right, and that's an important point. I mean, we wouldn't have thought of, we all know it, but yet not paid attention to this fact about, what it feels like when you're actually, lying down on a bed inside an ICU and you're seeing all these people with space suits or spacesuit-like, uniforms around you, and clearly not being able to communicate. Dr. Chatterjee, given all of this, how can we be more careful, or how do we I mean, what we need to do to protect ourselves against COVID is known. But given that all of this can happen, is there something more that we can do, or is there some way we can be more alert as citizens or as people who try to lead normal lives?
So as Dr. Shah said, that this mental illness is a major issue, even which we are finding. Forget about, I don't go into the ICU that much because I'm an internist, but I see all these mild to moderately severe cases in the floors, and mental illness is a mental means they are going into depression, anxiety. There, so we in our hospital we now have psychologists talking to the patient who want them to consult. So they telephonically consult, because what is also happening is that the relatives are not allowed to visit all these patients who are mild to moderately sick because they are in a COVID ward. So they are not allowed to visit. So they are all alone, and that's what is pushing them into anxiety and depression. So we actually in our hospital have a psychologist speaking with them. When we go for our rounds, we find out, oh, this lady or this gentleman is not doing too well mentally. So we have a psychologist. We always make them speak with him or her, and we have seen the benefit of it. So that's being proactive about it. So that's what we have started in the last 2 weeks only.
Right. And how do you see, my other question was, as you look ahead, is there a way that, knowing all of this, how can we be more careful, or should we be more careful beyond the care that we're already taking?
See, we have to be mentally strong. I always say that even the yoga and meditation are old time things, actually builds up your mental stability, your physical health and everything. So we have to have a healthy lifestyle. We should do exercises. We should have the right food. We should have a strong mental health, and yoga and meditation and all that does add to overcoming this illness much more. If you are mentally weak, if you are physically weak, if you have comorbidities, obviously that makes you more prone to all these after effects of the illness, which is more common.
Right. Dr. Shah, last word. So as you look, as you know, how do we as potential patients or citizens, I mean, how do we be more prepared for, clearly what lies beyond COVID? It's not just COVID.
Yeah, so, it is not the end of the game. We are still not done with COVID as of now. I think we should not lower our guard. The same precaution that we have been continuing since the last 4 odd months, we still need to continue. Still, the virus is looming very large nearby us. And one thing that we have not realized is the doctors are, gradually going into exhaustion. If you ask about me, after 3 months of rigorous practice, I have also, being into, it's a lot of difficulty for us also. So it's upon us, so the citizens now, that, we should take utmost care and not overburden our healthcare system, because it is also, not a healthy state right now. Even the healthcare can crumble anytime.
Thank you for that, Dr. Shah. And this, I'm sure, is something that we will try and convey to everyone. Think about the doctors, think about the nurses, and the sheer strain that the last 3 or 4 months have put on their lives and their professional lives, and therefore their ability to treat you, and do not do anything that will eventually put more load on them. Dr. Shah and Dr. Chatterjee, thank you very much for joining me, and I, as always, wish you and your teams all the very best in fighting this disease. Thank you very much.